Hi everybody, welcome to my chronic migraine life. It's been a couple of weeks since we chatted, so I wanted to update you all on what's going on in my chronic migraine life. About 3 weeks ago, I had surgery on my right eye. It was cataract surgery. And if you don't know why or you're looking for more information, you should really check out the last two YouTube videos of this series. I explain the long process of finding out why I needed this surgery and how I was preparing both mentally and physically for this. It was the first time I was ever having surgery. So while that was a little bit daunting, it wasn't really, it was not the actual process of the surgery itself that was concerning me. I've had other medical procedures done. I get Botox. I've had endoscopies where they sort of knock you out and put a scope down your throat to check out your stomach and stuff. And so cataract surgery is different in other surgeries that you're not being put out completely and that you're not staying in the hospital. You go home right afterwards, so a little bit afterwards. So I followed all of my notes as I discussed with Preparation is Key video. I took the entire day before surgery. I had been really feeling stressed. I should start with that. Really overwhelmed and anxious about the whole process leading up to the day of surgery. And then the morning of the day before surgery, surgery eve as I'll call it, I just woke up completely calm and confident, and I just felt like I was in a really good headspace. I was ready to take on this challenge. I was ready to have perfect vision in at least one eye. And I was just ready for this to be over with. I was tired of thinking about it. I was certainly tired of discussing it and tormenting myself. Which was really interesting that I felt that way on surgery eve, because ever since I had filmed those two YouTube videos, and I don't know if it was re-exploring or communicating or sharing, that really put me in a funk, a real deep funk. And something about the surgery eve morning, I just woke up and it was just gone. Finally, I felt like myself again. And so I spent the entire day, from morning till night, I didn't sit down once. I was cooking, I was cleaning, I was getting out my bag ready, I was doing all the things that I needed to do. And I felt really good about it. I was anxious to hear from the outpatient clinic where I was getting it done, the ambulatory building, if you will. Because, as everyone knows who's ever had surgery or known someone that has had surgery, no matter what kind of surgery, big or small, they never tell you the time of surgery until the day before. I don't understand why that is, because it's already in the books and very clearly already designated a time. I understand that it could change, and so maybe they should call the day before to confirm the time, but why it has to be a surprise, I'll never know. A lot of the anxiousness leading up to the surgery was all of the bullshit back and forth with doctors and nurses and between the two offices, the office where you visit the doctor versus the office that is controlling the appointment for surgery, all bullshit. Now, as we all know, I have chronic migraines, and a big stress, a big trigger for those migraines is not eating or drinking. So even though I wasn't being put out completely, I was going to be given some sedation and some drugs to relax, and because of that, you're not allowed to eat past midnight. Now, like I said, I've had endoscopy and stuff. Of course, you can't eat before that either, but those were early in the morning. I also have extreme gastritis, hence the endoscopy, and acid reflux. And again, the not eating and all of that stuff are triggers for that illness. So on top of having a first surgery and being anxious just in general, I don't need any of my other illnesses to flare. And so I'm finally confirmed that I can take my acid pill and my thyroid pill. I suffer from hypothyroidism as well. And, just not eat or drink after that. Just take mild sips of water. I'm also told that if, in case I get a migraine, I can take my pain pill. Except how many pills can a person take on an empty stomach? So I don't take that. I just hope that I'm going to be a champ. Anyway, it's still the day before surgery. And finally, I get a phone call telling me to be at the place, at the surgical site, at 1 p.m. And hopefully they'll take me by 2:30, 3 o'clock, the absolute latest. So I'm like, okay, I can live with that. I already knew it was going to be a long, stressful day. I knew my stomach and my head would probably lose their minds by the time I was all done, but whatever, I just had to power through it. I get to the surgical site at 1 o'clock and I walk in the building. And as soon as I get to the surgical floor and just to sign in, my anxiety the waves just rush all over me. Trying to be very calm. I don't want to cry in front of other people. I'm not alone. My parents took me. But I'm just trying to go through each step and take it as it comes. What I have to say is that the processing floor, if you will, where you get your intake done and do all the bullshit paperwork necessary before you go into the waiting room, were some of the rudest, incompetent people I have ever seen in my life. And it gave me a very terrified feeling of, what am I doing here? In fact, I remember going to the bathroom several times and closing the door and just having that panicked feeling like an animal when they're locked in a cage. I felt this terrifying wave of anxiety and fear and like, what the fuck have I gotten myself into? And now I've started a process that I can't actually stop, right? Because I'm in too deep. I already have my little bracelet. I can't get out of here. And that trapped like a rat feeling would stay with me until my surgery was over. And it was a long day. I had debated really filming this video, and I'm forcing myself to do it now because I'm in between having one surgery down and still having to go through this process. And it occurs to me that while not too long ago I shared about returning to the scene of the crime in a positive aspect, when I return to the scene of this crime for my next eye surgery, it's going to bring up a lot of extra trauma, even if I'm in a better mental space or I know what to expect. And I haven't really quite worked that all the way out in my head. You know, knowing you have to do something and people tell you just go through it, you'll get it over with, you know what to expect, isn't always a good thing. And when you have to relive one of the hardest or worst days of your life, even for a positive outcome, even because it's going to be worth it, even because you have no choice, doesn't make you feel better. And I really need to stress that because that's a lot of what I've experienced. So anyway, I'm there a few hours. They do my vitals. They do all the bullshit that you have to do. They start putting drops in my eye. Okay, fine. I do all this. Let's say it's 1:30, 2 o'clock. I walk into the waiting room and there is, 20 people there. And now, because at this time I didn't know that they were all going to be getting cataract surgery ahead of me, I just figured they were there for other things. You know, I've been to other, I don't know what they're called, ambulatory buildings, outpatient services, like, where you get things done and then you go home. Minor procedures or whatever. So at this point, I don't know that all of these people are ahead of me. I just assume they're there for whatever they're there for. Maybe some of them are ahead of me, but whatever. About 3 o'clock, I see the resident that will be performing my surgery. And she's talking to some patients on the other side of the room, and I see them getting upset, and she starts to walk towards me. Well, she's walking towards me to tell me that it's going to be a couple of more hours before I go up because they're opening a second OR, they're backlogged, whatever. I come to find out the next day, the word that she used that day was a totally anomaly. Everything that could go wrong went wrong. There were machines that were broken or whatever, that they needed medical instruments. They were short-staffed, whatever the case may be. I'm not entirely surprised. This is exactly what I was afraid of. And so I want to crumble to pieces, and I'm trying everything in my breath not to. I never prayed or chanted to my higher power harder than I did at those moments. I was exhausted. I hadn't slept it all the night before because I was just too amped up. And now it's 3 o'clock. What are we looking at? 5, 6 o'clock? For me to first get into the OR. Now, the surgery itself is very fast, but it's all the bullshit ahead of time. And now I haven't eaten. My head is starting to kill me. My stomach is really the most thing. And between the anxiety and the acid and the not eating or drinking, I was beside myself. The one thing that everybody had told me ahead of time was that it's not a big deal. Anybody that had cataract surgery or knew someone that had cataract surgery, it's super easy. And spoiler alert, it actually is. If I walked into that building and an hour later they called my name and I went upstairs and had my procedure done and did a little recovery, maybe a half hour there and went home, aces. Excellent. The reason all of this was not possible for me is because, as I mentioned in the other aforementioned videos, is that I was having a resident supervised with an attending, but do my surgery because in order to get the most expensive, the best lens, the cataract that they are replacing your natural lens with an artificial lens. There are various kinds, and they all do different things, and I wanted the one that gave me the best chance of not needing glasses 24 hours a day. And they're very costly, and the way for me to get this free was to let the resident do my surgery. But because the resident was doing my surgery and couldn't be in the room legally alone, the doctor that would be supervising her had to do all his patients first, and then he gets to go in the room with her and sit next to her and make sure she doesn't fuck up my surgery. But what that means is that my surgery is not able to go at 7 o'clock in the morning. If you are a regular person getting cataract surgery, you go in at 9 o'clock, they take you at 9:15, you're home by 11, aces. That would have been fantastic. But I knew that wasn't going to be the way it was for me. I had no idea it would be this bad, but it was all of my greatest fears realized. They didn't call me, folks, till 5 o'clock. And that was to go to the operating floor. That wasn't because I was getting surgery. It would be another 45 minutes, maybe longer, I'm lying to you, maybe over an hour before they actually started my surgery. You can imagine the state that I was in by then. I felt like I was going to death row. I said goodbye to my parents. They called my name. I went upstairs. And I see 3 people in the waiting room up there. And all of a sudden, my anxiety flares higher because now I'm alone. I have no one else to talk to distract myself in any way possible, right? There's no TV. I can't see at this point anyway. There's nothing to read. You don't have your phone. I have no one to talk to but to sit there. And my anxiety just bubbled over. I was at the verge of just walking out. I don't give a shit. The 2 older people ahead of me, everybody's very quiet, And at this point, I should mention that between the floor downstairs, the intake floor, and the operating floor, I am seeing numerous people running out of the building with their coats on. Like 20, 30 people. The fucking place is closing. And so my fear is 2-factor. Is that it's going to be 2 hours before they take me, or that they're going to cancel my surgery because it's fucking nighttime and the building is closed. And then that I would have been done. So I'm sitting on the little chair, whatever they give you. The anesthesiologist comes over, puts in the IV or whatever. It's not connected to any drugs. That's where they went wrong. They should have connected me to drugs. And we're all just waiting. Waiting and waiting. I'm not great with this. Finally, I decide that I'm going to be myself. And while the older people don't want to cause a ruckus, that is not my way. The anesthesiologist comes over to me and they take there's 2 people ahead of me on the floor that I see when I get there. But it turns out there was a gentleman ahead of me and the woman, this poor old lady who was, I find out, diabetic. How they kept her there till fucking 7:30 at night without eating or drinking is beyond me. It's a sin. Is after me, which for me, I was like, thank God, I can't wait for 2 more people. So I get bumped up, I get moved 3 feet away. I'm the next one. And the anesthesiologist passes me again, and I say, hey, excuse me, what the fuck goes on here? Just like that. And this startles the older people waiting, and this man, no one talks to him like this. And I'm like, I don't understand what's going on. And I just lay it on him. My entire stress. At this point, my stomach is killing me. I'm afraid I'm going to throw up. And I've just had it. I'm fit to be tied. And I'm on the verge of hysterical crying, but now I'm in my stage of anger, And I explained to him my conditions, that everybody knew this, but there was a back and the forth and whatever. Now, he's the senior anesthesiologist, and so he's apparently more laid back. And he's like, I always tell people that they can eat breakfast when they have a late surgery. But that, of course, was not communicated to me. And because other anesthesiologists don't feel this way, whatever the consensus is, so whatever. I said, I don't understand. I'm not being intubated, when they put something down your throat or they knock you out with anesthesia that way. I don't understand why I couldn't have eaten something light. That would have avoided a lot of my stress, and I feel violently ill. I also have stomach medicine that's a liquid that I could take. I brought it with me to take after surgery, but he's telling me that I probably could have taken it ahead of time. And with all the conflicting information, that's what I was really having a problem with leading up to surgery. Every Tom, Dick, and Harry had a different opinion and different advice, and I can't handle it. I couldn't handle it. I'm the girl that needs rules and structure and to tell me what to do so that I can do it and be best prepared. And it was a shitstorm. But he was delightful and a godsend. He said, let's do a couple of things first. He said, your stomach is bothering you. He gave me some milk and magnesia, similar to the medicine that I take anyway at home to settle my stomach. And instantly I felt better stomach-wise. So that was helpful. And he said, you're next. I swear to God, it's like a 10, 15-minute procedure. It's going to go beautifully. And then he listened. What was really important to me was not just his medical knowledge and all of that stuff, was that he heard me. I felt heard. He listened. He wrote down all the names of the people that had given me bad information and all of the shit show that was downstairs. And he said, we have a real big problem in this building, and I'm going to really try to work on it. He wrote their names down. I felt like even if he doesn't do anything about it, he was paying attention. He also asked me if I was in the medical business, RN or something like that, because I used the word intubated. Never heard anybody explain their situation like that. I said, well, I've had a lot of things done to me. I've been around a lot of people that have had surgery and stuff. I pay attention to details, and I want to really understand the process. So it made no sense to me. And so, flattery gets you everywhere. He calmed me down a great deal, and we ended up talking pretty much up until they took me for surgery. I asked what was a big concern for me was what was going to be in that bag of drugs. I have a bad experience with opioid medication because of my migraines. And I don't like the way they make me feel. They trigger migraines, in fact. And so they're giving me relaxing medication. What the hell does that mean? Well, come to find out that in the bag is whatever the light sedation is and fentanyl. And I stopped him right there. I said, I can't take fentanyl. I've had terrible experiences with it. And whatever you think you're doping up people with, whatever that dosage is, I want mine cut in half. I don't give a shit. I can't take that. He assures me that it's going to be fine. And quite frankly, at this point, the thought of being high, even if it caused a migraine, was delightful to me. I was so anxious and beside myself with all the bullshit of that day. I mean, it's fucking dark outside, and I'm not even started yet. It sounded like a dream to me. Finally, I think it's about 6:15 or 6:30, they take me into surgery. And from where I was sitting at that time, talking to the anesthesiologist, I can see the operating room. And now, in my mind, the only experience I've had of being in an actual operating room was via Grey's Anatomy. I'm picturing that long slab metal table, and for whatever reason, I assumed I'd be on it. That's not it. It was actually looked like a doctor's office room. It just had whatever machines they use for your eyes, and those giant lights or whatever. So they wheel me in, and at this point, I don't give a fuck about the surgery. I just want the drugs, and I want to go home. Home, 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 home. The first person I encounter in the operating room is maybe my favorite person on earth, and I don't think he even knows who I am. He was a Hispanic gay nurse, and the only reason I bring this up is because he had the most perfect personality for me. He was used to dealing with all old fuddy-duddies, and with me, he could be a little raunchy and a little funny, and it is exactly what I needed. If I see this man again on my second surgery, and I have the chance, I'm going to kiss him right on the mouth. He saved my whole soul that day. Whole soul. Put me instantly in a calm, stabbed me right out of that whole whatever had happened outside that door, and inside this room was a whole different experience. He was just so kind and funny, and he called himself my bartender because he connected the IV to the drugs, and they asked me what kind of music I like, and they were pumping Justin Timberlake music, and everybody in there was super nice and functional, which is, of course, the most important room in that building, so that's where they should be. They should keep all the functional people if they don't have any to spare. And it was a godsend. Shortly thereafter, my surgeon came in, and the attending, the doctor that I also knew. And so you're in these sort of like, I don't know how to describe them. They're not really beds. They're like those chairs you ever see in a hospital that have really high backs with cushions. And your feet are just sort of on the ground, kind of like a wheelchair. So they put all the gowns on top of me or whatever. I get a fancy hairnet. They strap your arms lightly to the side so that you don't move during surgery, and they also put a band around your forehead. What I didn't know, and which is probably why they don't want people to eat, because people are stupid and without very specific instructions will eat a big cheeseburger 20 minutes before surgery, is that they actually tilt you all the way back. So you feel like you're going to fall off the chair bed scenario. You're not. It's probably another reason they strap you in. And I'm glad they strapped my head, because I was paranoid that I would move or do something that was going to ruin my own surgery. And that feeling felt strange at first, but then that's when the fentanyl kicks in, and then you don't realize anything. I didn't actually fall asleep, but I was very, very relaxed. And the time went very fast. Also, considering I'd already been in that building 6 hours, 15 minutes isn't anything. I hear the doctor come in, but they've already draped my face. So they're covering the left side of my face so that it's just the right eye's exposed. Like the paper that's made out of like a hospital gown kind of a thing. Very light. And so they just begin. I don't feel absolutely anything. Not really paying attention. But at the end, I hear the attending call my name and said, "Donna, do you see, can you look ahead? Do you see that bright light?" Which sounds funny, but it's not. And I do. I see a bright light. I say yes. He said, "Can you just focus, if you can, for 30 seconds, just straight ahead?" And so I'm trying to do my very best, because now I'm afraid that now all of a sudden I have to be a part of this. I hate when people say, hold your breath, or look here, you concentrate on that spot. Shit, am I doing a good job? And then he says, "Okay, perfect. You're all done." So now if you fall asleep, I guess that's not the vital part, but maybe he was just, I don't know. So I'm all done. They sit you up, and that's when I sort of felt dizzy at first. And so they let me sit there a few seconds and get reoriented or whatever. They wheel me down the hall to the first recovery room, and they're just really checking your vitals, making sure you don't feel nauseous from the drugs or whatever, bleeding. It turns out your eye, where the cataract is, I should specify, is in the dead center of your eye and your lens, and so there's not a lot of nerves, so there's not a lot of bleeding. They also aren't doing any cutting or stitching. My doctor explained it to me like this. A cataract is sort of like an M&M. The actual lens, so there's a hard exterior shell, and the cataract is like the chocolate inside. So when they perform cataract surgery, they're making a little crack in that hard shell. They use a vacuum-like tool, not their hands, to suck up the cataract that they've broken up, to remove the old one, and plop the new lens in there, and eventually it just seals and closes and attaches to your eye. So there's no stitches, so there's no real bleeding or anything like that. But this is why afterwards, what you're allowed to do, you have to really adhere to, so that it stays perfectly in the place that they've put it in, and it doesn't move or detach or anything crazy. I would have felt more comfortable with a stitch, because then I knew it was staying in place, but that's not how they roll. Anyway, I'm in the first recovery room, and that's when I all of a sudden feel like I can't keep my eyeballs open anymore. I haven't slept all night. Now they gave me the, sedation drugs, and this is when they kick in. And the nurse says, "How do you feel?" And I'm just I'm so tired. And she's like, "So just close your eyes." I was like, "Oh, okay." So I closed my eyes. I should also point out that from the operating room, you don't realize it because you're so buzzed from the drugs, but I already have a patch on my eye. I knew it would be bandaged, but in my mind, it was like a bandage that you couldn't see through. You know what I mean? But this is not the case, I guess, because they want you to see a little bit. So it's like a hard plastic on the outside, and it has these little cutouts, and on the inside, it's kind of like a mesh. So it's not really touching your eye, and it's not really obstructing your vision completely. You can see through the little shapes or whatever. Of course, it's not perfect if your eye was not bandaged, but it's much better than I thought it would be. And now at this point, it's already after 7:30. So I have a doctor's appointment at 10 a.m. the next morning where they're going to remove this and check my eye. So it really wasn't a big deal. So I closed my eyes for a few minutes, or what felt like a few minutes. And then the nurse says, okay, you're ready to go downstairs. So I go back down to where you get intaked, because that's like the exit room. And at this point, there's like one person still working there. And they're in a real hurry to get out, and still assholes, but whatever. They make me sit in I get off this bed, I sit in a chair there. They monitor my blood pressure, my vitals, whatever, for like a few minutes. And then finally my parents come in. Actually, I had to tell them to go tell my mother that my surgery was over because she was having a heart attack at this point. It had been like 3 hours since she saw me, and she's like, what the hell? Nobody, of course, updated her that they didn't take me right away, and they were supposed to call her or go to the patient, parent, whatever, visiting room and tell people, but my parents were the last ones left, so of course they didn't know any of this. So finally they come in, and now I'm able to drink, and because I'm so good at preparation, I had already frozen a Gatorade that was like music to my mouth at that point, and then they let me go. In the car, I was just so drowsy and starving. So by the time I got home, it was about 8:30. I ate a Burger King chicken sandwich, some Honey Nut Cheerios, of all things. I sat down, I watched a little TV, and I started to doze off because I was just that wiped. Mentally, physically, everything. So I went up the stairs, and all the things I was worried about with my vision, especially being bandaged, wasn't really so bad. I really thought that I would be all cockeyed with one eye bandaged, but because you have those little slits or whatever, I guess, it's not really so bad. The tape was like from here to here. That's really the other side, so it was like this way. So like I didn't wash my face or anything. I just brushed my teeth. I put my clothes on. I went to bed, and I was out. So the next morning, I get up. We go to the doctor's office. Now, the doctor's office is not where I would normally go if I was seeing the attending, but the resident center is a shit show also. And I knew that ahead of time, and like people talk about this location like they don't want to go there. The traffic outside is insane. The commotion inside is insane. But I just had been in Bear and Greer. I can't even speak. You get what I'm saying. But walking into that doctor's appointment, for starters, the entire way there, I must have drank like 3 bottles of water. I ate. I was just happy. I walked in, and the stress that I had felt prior to my surgery, the last time I was in this building, the stress, because I knew that I was planning my surgery and finding out what these people had to say about my eye and doing all the testing and how that triggered my migraines and all that bullshit, I felt like I was walking on air. I was so happy to have that surgery in the bag. Like, haha, I'm all done. Yes, I look like a moron with this bandage on, but here I am, and I'm happy. I was still there over 2 hours by the time they took me, but the actual appointment went very well. They take the bandage off. The tape hurts because why they have it felt like packaging tape, not medical tape, on my face. That hurt like hell to get off. But they put more drops in my eyes and dilate it and ask me to do a vision test, which instantly brings up old trauma and anxiety because I failed my vision tests. Before surgery, both of my eyes were 20/100. That's why it was illegal for me to drive. Not that I felt comfortable doing so, and the problems reading. My vision was that bad. The day after surgery, my right eye, which had been operated on, was 20/25. My doctor said it was better than the vision she has. She was wearing glasses, ironically enough. And I couldn't believe it. And so she gave me something to read close up, and I couldn't see it at all. And she's like, well, it's literally not even 24 hours after your surgery. Your eye is all dilated still from the drops they gave you for surgery. I just did it again so that I can look in your eye, and don't worry about it. So I'm like, okay. She looks in both of my eyes. Why she looks at the second one, I don't know, but maybe the pressure is related. My pressure is perfect in both of my eyes. Eye pressure is not the same as blood pressure, just so you know. And she says, it's perfect. The lens is exactly where she placed it. It's in the perfect placement. She said it was a textbook perfect surgery. Folks, I have to pause here because there has never been anything textbook medically about me in my life. Not in a positive way, anyway. And I was thrilled. That morning, before I first woke up, like that night, I should say that night, I felt a little like sand grittiness in that eye, which they say is very normal. But that went away from me very fast. Um, it felt fine. It felt very like sticky and gooey, because again, there's mucus and things that your eye is processing all the crap out of it that it was put into it. It's mostly the drops. When I woke up that morning for the doctor's office, it was like 7 o'clock. I had to get up early and leave early because it was rush hour and the place isn't close to my house. It was the first time I freaked slightly. I couldn't open my right eye. You know, if you've ever had pink eye and it's sealed shut with that goo and that grossness. Now, of course, I couldn't see my eye because of the bandage, but I couldn't open it. And I started to freak out. I could feel that it was all gooey and wet, but it panicked me. But that didn't last very long. It was maybe a minute or two and I could pry my eye open again. I desperately wanted to do this. But of course it was bandaged, and of course that's why they bandage it so you don't touch it. But I wanted to. It just felt nasty and that it needed to be cleaned. So after they take the bandage off, I should say, before they actually look in my eye and put more drops in, they ask you to close your eye. They have a medical wipe, whatever the special stuff they're allowed to touch your eye, and they clean it. And that was like a godsend. When she looked in my eye, she said it was still inflamed and still had some mucus around it, which was totally normal, and then it could leak or feel gross for the next couple of days. You are told to put 3 different kinds of drops in your eye 4 times a day right after surgery for the first 2 weeks after surgery. And so it's flushing out all that other stuff. One's an antibacterial so that you don't get an infection. One's a steroid to help the inflammation go down. And one is sort of like a pain prevention drop, or like it just helps like the back of your eye not get swollen. It just helps. So that could also make it gooey, cleaning out your eye. I never really had that though after the first day. Of course, once you put drops in your eyes, tears sometimes. That's fine. I hate putting drops in my eyes. I always have. I don't know why. It's not that it's painful. It's just that like plop when it goes in your eye. It freaks me out. I've gotten better at it because I had no choice, but so that visit went perfect. I asked all the other questions that I had about the surgery, and she apologized for the craziness. We actually scheduled the second surgery for 4 weeks after the first. So that was good. I was super eager. The other thing about the doctor's office is, so they had taken my bandage off, cleaned my eye, and sent me back to the waiting room. So the doctor's office was like dimly lit, but the waiting room is not. It's fluorescent lights, which should be illegal in any place. And I felt disoriented instantly. And I don't know how to explain it, but this is what I've been saying, is that I feel like out of the good eye, I can see the blurriness on the outside of the left eye, which is not a thing, but it's like seeing kind of an aura. And they're telling me that it's not even 24 hours out of surgery yet, so not to worry about it, but it is disorienting. And I knew this was going to be a thing because now my vision is so different in both eyes, but we'll talk next time more about how that affected me and the repercussions of it were of being half fixed. But in that moment, I was just relieved. I felt like I could have done the cha-cha home. And so they give me like the cataract glasses, the old lady glasses. They're not as bad as actually the ones I've seen, the ones that come all the way down here. But they want me to wear them outside because they don't want anything flying in my eye. They have a special like tint to them, so the sun. And my instructions besides doing the drops were for the first week, I'm not allowed to bend down at all. I'm not allowed to lift anything heavier than 10 pounds. I can watch TV or read or do whatever feels comfortable, but not to strain my eye, and essentially just take it easy. So that's why the eye, the lens isn't stitched in. They want to really make sure that everything is taken care of. On the way home, wearing my very fancy cataract glasses, I was falling asleep in the car, and I was sitting in the right past the back in the right hand side. So I was looking out the right window, and I guess because that was the dominant eye that I was using, my right eye, even with the dark glasses on, the clouds looked big and clear and bright. And it was like I put Technicolor in my eye. Like, the Wizard of Oz when it's all black and white, and then she goes to Oz and it's all colorful? That's what it felt like. I went home that Friday. I was exhausted, got something to eat, and set myself up on my couch to watch DVR TV shows and just chill and nap and chill and do drops and chill. And the entire time I was laying on my right hand side and I kept going like this. Bad eye, good eye, bad eye, good eye. And instantly I could see the time on my cable box. I went to the bathroom and I noticed all these little nicks in the paint. My mother didn't care for that commentary, but I'm noticing things that I'd never seen before. Or, as my very wise neighbor pointed out, you were losing your sight so gradually, you forgot what you weren't seeing. And in that instant, I was so proud of myself for doing something that I knew would be the best thing I had ever done for myself, aside from trying Botox. And it was miraculous. It was miraculous. And so while my vision was still sort of cockeyed altogether, I was able to see TV comfortably. And so that's just pretty much what I did. For the first week, they also give you this little night guard to put on your eye. It's essentially a hard piece of plastic. It also has holes in it so you can see out of it and I guess get air in your eye that they want you to sleep with at night because they're afraid you're going to rub it. So not to touch your eye is also very important. But you're so hyper aware, or at least I was, not to touch it or fuck it up that it was fine. In fact, I found myself like touching my other eye just when I felt the sensation so I would get it out of my system but not do any damage. So after all that's said and done, now when I go to a doctor's office or someone asks, I can check that box. Yes, I've had surgery, and yes, it was successful, and I made it. And we'll talk next time more about what happened in the days between then and now. So thank you all for your well wishes, and I will see you next Tuesday.